Today we are going to start third lecture from the Ocular Appendages unit of Ramay's Ophthalmology book. First of all, we will study the muscle known as Levator palpebrae superioris muscle. Levator palpebrae superioris muscle, also known as the LPS muscle, has two parts. Okay, one is the striated part, and the second one is the smooth muscle part. Striated part is supplied by superior branch of the oculomotor nerve. This is very important that it is supplied by superior branch of the oculomotor nerve, and the smooth muscle part, this is supplied by sympathetic fibers from superior cervical sympathetic ganglion. Okay, the nerve supply of LPS muscle is very important in aspect of MCQs. The LPS muscle, it originates from the inferior surface of the lesser wing of the sphenoid bone and anterior to the optic canal. I will show you in the diagram. Here, this is the levator palpebrae superioris muscle coming from the inferior surface of the lesser wing of the sphenoid bone. This is the levator palpebrae superioris muscle located above the superior rectus muscle. This is superior rectus. It is located. LPS muscle is located above the superior rectus muscle here. So, this muscle has two horns, lateral and the medial. Okay. Let's see in the other diagram. We can see here that this is the levator palpebrae superioris muscle coming down. It divides into two parts here, like this. This is the lateral part, and this is the medial part or the medial horn. This is continuous with the medial palpebral ligament. Look here. This is the medial palpebral ligament, and the lateral horn is continuous with the lateral palpebral ligament. Look at the two horns, lateral and the medial. Lateral is attached to marginal tubercle of the zygomatic bone and lateral palpebral ligament. We have seen that. Okay. The medial horn fuses with the orbital septum and the medial palpebral ligament. Very important. Okay. Next, we will continue. The next part is the conjunctiva. What is conjunctiva? This is a thin mucous membrane that lines the eyelids. There are three main regions of the conjunctiva. One is the palpebral, second one is the bulbar, and the third one is the conjunctival fornices. Let's create these parts in the diagram. This is the diagram to show you the conjunctival parts. First of all, this is the palpebral conjunctiva. This conjunctiva lines the upper and the lower eyelid. These are the eyelids, and palpebral conjunctiva lines the upper and the lower eyelids. The second part is the bulbar conjunctiva. The conjunctiva which lines the white of the eye or the sclera is known as the bulbar conjunctiva. You can appreciate here that there is a transition zone between the bulbar conjunctiva and the palpebral conjunctiva here. Similarly, here and here. This is known as conjunctival fornix. Okay, later on we will study that there are different fornices present, and look here, conjunctival fornices. We have studied that between the palpebral and the bulbar conjunctiva there is a transitional region of the superior and the inferior fornices. Okay, there is also lateral fornice. And what is the distance of fornices from the limbus? First of all is the superior fornix. This is 10 mm from the limbus. Inferior fornix is 8 mm from the limbus. And medially, there is no fornix present. Okay. Laterally 14 millimeter. Laterally 14 millimeter, and it extends back to the equator of the eyeball. That is an important point. Okay. In this diagram, you can also appreciate this is the bulbar conjunctiva lining the sclera or the white of the eye, and here this is the lid, and also this is the lid. This lining the upper and the lower eyelids. So let's read the bulbar conjunctiva in detail now. Bulbar conjunctiva. We have already studied that this part lies in contact with the eyeball, or that lies in contact with the sclera or white of the eye. Okay, this is a thin, translucent, and white sclera is visible underline. Okay, white sclera is visible underline, loosely attached to the sclera and the facial bulbi, covering the tendons of the recti muscle. Okay, this conjunctiva is loosely attached to the sclera and the fascia bulbi, covering the tendons of the recti muscles. We can divide the limbus into different parts. Corneal limbus, where the cornea fuses with the sclera. The second one is the conjunctival limbus, site where conjunctiva fuses with the cornea. This is 1 millimeter anterior to the corneal limbus. And bulbar limbus, which is the site of fusion of the bulbar sheath with the sclera, 1.5 millimeter posterior to the corneal limbus. There is a site where the conjunctiva is loosely attached to the fascia bulbi and the sclera. We have studied that already. This site is 3 millimeter posterior to the corneal limbus. Posterior to the corneal limbus. Conjunctival epithelium can be divided into two parts with respect of bulbar conjunctiva and the palpebral conjunctiva. If no part is mentioned or nothing is mentioned like palpebral or the bulbar conjunctiva, then you should know that the conjunctival epithelium is stratified columnar epithelium. We should choose this one when nothing is mentioned, neither the palpebral or the bulbar conjunctiva. Or if the bulbar conjunctiva is mentioned, then we should also choose stratified columnar epithelium. Because later on we will see that the epithelium of palpebral conjunctiva is stratified squamous non-keratinized epithelium. Stratified squamous non-keratinized epithelium. So this is the epithelium of the two parts of the conjunctiva, palpebral and the bulbar conjunctiva. That was all about today's lecture. Now have a look at the questions which can be asked from this section. The levator palpebrae superioris muscle is supplied by which structure? One of these. And the which conjunctival fornix is closest to the limbus? Okay, you can give the answers in the comments. The final answer will be provided in the comment section.